I'm Assad Butt. I'm a paediatric gastroenterologist, and I've been in Sussex for the last 20 years and developed the specialist paediatric service in the region. I was always interested in, I didn't really know what I wanted to do, but I was always interested in the biological and also the social sciences. And I think medicine gave an opportunity to do both. And of course, most importantly, my grandmother said that she wanted a doctor in the family. So that was what clinched it. So the choice of my specialty was partly by chance, but I got, there was a period of time when I wasn't in a regular job doing some locums, and I did a locum with a professor of pediatric gastroenterology from who was had just come to the UK from Australia, John Walker Smith, and I did work with him, and then I got just interested in the speciality, and I guess the thing which is attractive for me that it combines both medical as well as surgical speciality, because you get the opportunity to do technical procedures like a surgeon, but then you're actually a physician doing the thinking and treating as well. So I grew up in my preschool years in East Africa, in Kenya. So that's, and then came with the family to the UK. So in UK, I was brought up really and schooled in the UK. In West London, so in the borough of Richmond. So that's kind of where I grew up, I guess. I guess over time, you know, what you appreciate changes, but I think the most important two things are firstly the patients and the families and the sort of recognition of what you've done from them. I think in pediatrics, you know, that's the dimension which is not found in adult medicine, because you look at families, children, etc. And the other thing is, I think, you know, working with you know, tremendous colleagues over the years and working with many different specialities, and in this my particular speciality, there's a lot of multidisciplinary team working. So it is really a teamwork approach, and I think that those are sort of two things which are the most important for me. I think most, I would hope, and I think most say that I do deal with them honestly and try to do my very best. I guess those are the two things, and I think not shying away from saying it the way it is, because I think, you know, sometimes, you know, there are limitations from what the answers that medicine or treatment can provide. So I think it's always important to do the best where you can, which I hope they think I'm doing that, and doing the best for them. So I think that would be, I hope this is what they would say for me. Pediatric gastroenterology nutrition, it does have challenges, and the conditions, I guess the most important challenge is that the conditions can be quite varied, and the symptoms of gastrointestinal disease may be related to functional conditions as opposed to organic conditions. So functional conditions are those where there's no underlying pathology, but they may be related, for instance, irritable bowel syndrome or functional abdominal pain, whereas organic conditions like Crohn's disease or celiac disease, there's an underlying diagnosis-specific treatment. So the symptoms of these things can coexist, and distinguishing between them is important. And I guess so. If there isn't an underlying disease condition which explains the symptoms, then actually explaining how functional bowel disease works, that can be a challenge, because it's not so easy to explain, because this is the way how feelings and emotions can also affect gut symptoms. And this is related to how the brain and gut are connected by nerves. So brain, gut, and these are things which are difficult to explain and difficult to measure. So psychological, emotional factors can also affect bowel symptoms. So I think this is the challenge, is trying to distinguish between them, and also how to manage the functional bowel conditions, which are more challenging, though less serious, compared to the organic conditions, which are potentially more serious, but our answers are more clear-cut in terms of the evidence for it. In terms of mantras at work or catchphrase, I don't really, I don't think I use any mantras, but my team may say other things. But one of the things I use in general is, which I think applies to work as well, and life in general, is if you don't use it, you lose it. So for that, in terms of work, I think that applies to using your skills, keeping up to date, striving for the best. And I think if you can do that, then you won't lose it, and you'll maintain and also improve the situation. So that would be my mantra. So that's what I tell my kids a lot.